Trump's devastating cuts to FDA and NIH threaten future medications. Imagine a future where groundbreaking medications that could transform healthcare and save countless lives never see the light of day. That's the stark reality we face if the Trump administration's proposed cuts to the FDA and NIH are implemented. But here's where it gets controversial. These cuts could severely hinder our nation's ability to innovate and lead in medical research. Jeremy Berg, a former director of the National Institute of General Medical Sciences at the National Institutes of Health, shared his concerns with the New York Times. According to Berg, many of the medications that won't be developed due to these budget slashes are likely to be pioneering first-in-class drugs, those that offer entirely new approaches to treating diseases. The Congressional Budget Office, CBO, analyzed President Donald Trump's proposal to cut NIH funding by a staggering 40%. Even a more modest 10% reduction in the NIH budget, the CBO found, could prevent up to 30 new medications from reaching the market over the next 3 decades. To put that into perspective, a 40% cut could be exponentially worse, potentially halting the development of numerous life-changing treatments. The impact on the FDA is equally concerning. One proposal includes cutting staff, which would increase review times for new medications by a whopping 9 months. By the second decade of this policy, the CBO predicts that 10 fewer drugs would be approved annually, a 2% reduction. Over time, this could prevent up to 23 new medications from coming to market. Already, the FDA has seen a significant reduction in its workforce, with approximately 15% of employees either losing their jobs or resigning. In 2025, the FDA has approved only 25 new drugs so far, down from an average of 60 per year in previous years. This unprecedented assault on our healthcare institutions by the Trump administration could have far-reaching consequences. It risks cutting off access to medicines that patients desperately need, handing over the mantle of global medical innovation to countries like China, and inflicting widespread harm on our nation's economy. Democratic lawmakers, including U.S. Reps Brendan Boyle and Frank Pallone, and Sen's Bernie Sanders and Jeff Merkley, have expressed their deep concern. They argue that the CBO's analysis likely underestimates the true impact of the proposed cuts, given that it only considered a 10% reduction rather than the full 40% that the president has proposed. Every dollar invested in NIH research returns $2.50 to the U.S. economy, the lawmakers pointed out. The United States leads the world in medical innovation because of our ongoing investments in the NIH. In essence, the Trump administration's devastating cuts to NIH and FDA funding threaten to grind to a halt the United States' efforts to bring cutting-edge treatments to patients suffering from cancers, rare diseases, cardiovascular conditions, and neurodegenerative disorders. What do you think? Should we be concerned about these proposed cuts, or do you believe they are necessary to balance the budget? Share your thoughts in the comments.